My name is Dr. Jonathan Beatty. I'm a naturopathic doctor here in Ontario. Digestive issues are so common these days due to, in part, poor diet. In a lot of cases, medications interfere with how people are capable of digesting, as well as, in many cases, a lack of adequate stomach acid and digestive stimulation. People with poor digestion actually face malnutrition. So the biggest concern there is you're not able to adequately digest and absorb the nutrients from your food, liberating them so the body can use them. And so because of that reason, people with poor digestion will often experience a variety of nutrient deficiencies, and often they're difficult to diagnose because they actually have complex deficiencies, so deficiencies of multiple nutrients at once that will actually cloud accurate diagnosis. Multi-enzyme supplements work to improve digestion by providing the variety of enzymes that would normally be found in the human intestine, and allowing the breakdown of the full food product. So all the varieties of sugars, the varieties of fats, the varieties of proteins that exist within your food require different enzymes, and so a multi-enzyme supplement is capable of breaking down all those various nutrients so that the human body can digest and absorb them. Well, the most common enzymes you'll see are amylases. Oftentimes people are deficient in those, but you want to make sure that you're going to get something that will break down all carbohydrates, which is very important. So items such as alpha-galactosidase, and sucrases and a variety of things to help break down sugars. As well as things such as proteases for breaking down proteins, lipases for breaking down fats, and then ideally something with a cellulase and a hemicellulase to actually help to break down the complex fibers that make up the walls of plant material, because often one of the biggest components people lack in their digestion is proper chewing. When people don't chew properly, they're not breaking down the food products into small enough pieces that the enzymes can have their proper effect. You're not basically making it usable by the body. And so using enzymes that have these basically extra chewing enzymes in them will help to break down your food where the person's lacking. Multi-enzyme supplements should be used when people are on medications that interfere with their ability to digest and absorb their nutrients. They can be used in people, especially as we age, if they notice that their digestion is failing. If they're on medications to block stomach acid, as stomach acid is required for the normal secretion of digestive enzymes. So there's a variety of cases in which people would notice digestive enzymes helpful. Especially too, it's a little uncomfortable for people to talk about, but when they see undigested food in their stool, that's a good sign that you need some extra enzyme help to break that food product down. Many times people will feel a lot better when they take a multi-digestive enzyme. By being able to properly break down your food, you'll prevent the bacteria in your gut from doing that for you. So you'll lower rates of bloating, you'll lower that excessive fullness feeling, oftentimes relieve constipation, or on the flip side, relieve diarrhea or looser stools because of, again, proper digestion. And then because of the adequate absorption of nutrients, you'll also find people will generally feel more energized because they're able to get the nutrients out of their food.